everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will be studying a very important topic, that is the topic of malignant hypertension, and you will be getting a short note. Let's just try to make things very simple and not very complex, because I know you will not revise at the end if I make things so complex, right, and so elongated, right? So let's study. So malignant hypertension is basically what? A severe life-threatening form of hypertension. It is basically a severe form of hypertension characterized by the systolic blood pressure. The systolic blood pressure is more than or equal to 200 millimeters of mercury, and diastolic more than or equal to 120 millimeters of mercury. And I hope you know how to measure the blood pressure with the help of sphygmomanometer, right? Not the digital one. You should know how to take the BP manually as well. So it is associated with acute targeting organs like kidney, eyes, brains and heart. If the hypertension is so much, first thing, there will be vision problem in the person, their brain will stop functioning well, there will be problems related to heart and problems related to the kidney, right? What is the etiology? So etiology you have of different systems, right? The first one is the renal one. In renal one, the person will be having the chronic kidney disease. There will be renovascular hypertension and polycystic kidney disease. In the endocrine one, there will be pheochromocytoma, Cushing primary disease and the thyroid disease. In the collagen vascular disease, there will be systemic sclerosis. In the pregnancy, there will be preeclampsia or eclampsia, and preeclampsia and eclampsia are mainly for your pregnancy. They are mainly seen in the pregnancy. In the drug, you have cocaine, then you have the MAO inhibitors with tyramine and oral contraceptive pills. And tell me, what are the oral contraceptive pills that you know, because you should also know the names of the oral contraceptive pills. Let's see the pathogenesis. So in the pathogenesis, the first thing that you have, there will be increased vascular permeability. Obviously, you have, like, I'll draw a diagram for you. Like, you have the blood vessels and the blood is coming. If there will be a lot of blood that will be there, then what will happen? The blood vessels will also become dilated, right? There is increased vascular permeability and there will be fibrinogen and plasma protein leak. Obviously, if there is a gush of blood coming through the blood vessels, there will be the leak of plasma proteins and the fibrinogen through the vessel walls. Then there will be fibrinoid necrosis, and I have already told you in the chapter of your journal pathology about the fibrinoid necrosis. There will be platelet deposition and activation, as a result of which there will be thrombi formation. After the thrombi formation, there will be the narrowing of the lumen. First, what happens? There was a gush of blood that was coming. Then there will be increased vascular permeability, as a result of which the vessels will form the fibrinoid necrosis. After that, there will be platelet deposition and activation of the platelets, as a result of which there is thrombi formation and narrowing of the lumens. The lumens will become narrow. Next you have is the hyperplastic atherosclerosis. That is also called as the onion skin lesions. You have to tell me where we have studied about the onion peel appearance. You have to tell me where we have studied about the onion peel appearance. I know we have read about this onion peel appearance many times, but you have to tell me, okay? Next, that results in ischemia of the organs like kidney, retina, brain and heart. Let's talk about the pathology. In the pathology, you will be having the kidneys will be normal or slightly reduced in size, and there will be a flea-bitten kidney. Like these, I don't know what I am drawing. Okay, like the size of kidney, these are your beautiful kidneys. So it will be like this. These are nothing but a flea-bitten kidney. There will be flea-bitten kidney appearance due to the pedicle cortical hemorrhage. In the microscopy, you will be able to see the fibrinoid necrosis, and we have seen the fibrinoid necrosis in our journal pathology. There will be onion skin, there will be onion skin hyperplasia. Okay. What are the clinical features that you can have? There will be sudden severe headache, dizziness and fatigue. The person will feel a lot of severe headache. In the neurological, there will be hypertensive encephalopathy. This means the person will be having confusion. Seizure will be there, as a result of which the person will land into the coma and stroke. Ocular clinical features, there will be blurred vision, papilledema, retinal hemorrhage, exudates and something called as a cotton wool spot. Cotton wool spot that will occur. In the renal one, you will be having oliguria and hematuria. There will be rapid rise in the serum creatinine level. Then you have the cardiac one. In the cardiac one, there will be acute left ventricular failure. The left ventricular portion of the heart will fail. There will be angina, myocardial infarction, aortic dissection, and in others, you have to write about your favorite thing, that is nausea and vomiting. And epistaxis. You know what is epistaxis? Epistaxis is nothing but blood coming out from your nose. That is called as epistaxis, and it is a short note in your third year ENT exams. Okay. What are the investigation you will do? For the investigation, the first thing you will order is the blood investigation. In that, you will be able to see there will be increased level of urea and creatinine. Microangiopathic hemolytic anemia will be there. In the electrolytes, there will be electrolyte imbalance, which will lead to the metabolic acidosis and hyperkalemia. In the urine, you will be able to see that there will be blood in the urine, hematuria, protein in the urine, and RBC fast. In the fundoscopy, you will be able to see the hypertensive retinopathy like papilledema, cotton wool spot, and retinal hemorrhage. What are the complications that can occur? The complications that can occur are in the CNS. You will be having hypertensive encephalopathy, intracerebral hemorrhage that we have seen in the topic of your brain injuries. Okay, that is due to the hypertension. There will be ischemic stroke. In the eyes, there will be hypertensive retinopathy, and as a result of which the person will be having cotton wool spots. There will be papilledema and blindness. In the kidneys, you will be having the acute kidney injury, malignant nephrosclerosis. In the heart, there will be acute left ventricular failure, myocardial infarction, arrhythmias, and sudden deaths. In the vascular one, there will be aortic dissection and aneurysm rupture. You know what is aneurysm? We have told that it is the ballooning of your blood vessels. It is the ballooning of the blood vessels. What is the management? For the management, you have the medical management that is required immediately. It targets the blood pressure mainly, reduce the mean arterial pressure by 25% within 1 to 2 hours, then gradually to 160/100 within the 6 hours. So step by step, there should be reduction of the blood pressure, because you cannot reduce the blood pressure whole together, right? There should be a stepwise approach. Just like for your exams, you should have a stepwise approach, how you should approach this subject, how you should approach another subject, right? Next, you have the drugs. The first line drugs are your sodium nitroprusside, IV labetalol, that is for your hypertension, nicardipine. Then you have, what are the alternatives? You will use hydralazine. What are the supportives that you will give? For the supportive, we will give the dialysis. If there is kidney failure, the first thing that should come to your mind is to give the person dialysis. Oxygen should be there, diuretics if pulmonary edema is there, and you have to treat the underlying cause like the renal artery stenosis, like the endocrine disorders, and pregnancy induced hypertension. These are the things that you need to keep in mind. Now we are done with this chapter. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. I hope I made this chapter very, very clear for you. Thank you so much.